Today was Mental Health Advocacy Day in the legislature, and the occasion brought a reminder of the ongoing struggle to get people help when and where they need it. State House reporter Devin Bates with that story.
In 2021, we told you about a troubling trend playing out in emergency departments across Vermont. Capacity pressures had caused a logjam in the state's mental health system, and children in a crisis were waiting days for treatment. 1 year later, those in the front lines say things haven't changed all that much.
This Monday morning, there were 11 youth in the UVM Medical Center Emergency Department for mental health needs, and their average length of stay at that point was 11.2 days.
Haley McGowan is a child psychiatrist at UVM Medical Center and said if you include kids waiting elsewhere in the hospital for a mental health placement, the average wait extends to 15 days. It's not a phenomenon that's isolated to any one hospital.
As of this morning at Central Vermont Medical Center, we have a 14-year-old boarding in the emergency department who has been there for 18 days, as well as a 16-year-old who has been there for 14 days with no end in sight or disposition for either of those situations.
Faced with a crisis that's proven it isn't going away without fundamental changes to the system, Vermont lawmakers in the Senate Committee on Health and Welfare are considering a trio of bills to build up the state's mental health infrastructure.
It really depends on where you are in the state as to what you can expect for a response in a mental health crisis. The consistent thing that I hear from mostly police and mental health crisis clinicians is that we need more resources.
One bill would help free up space in Vermont's hospitals by opening up peer-operated respite centers, a place to go for those who could leave the hospital but aren't ready to go home. The second bill would help keep those centers staffed with a peer support specialist certification program. The final piece of legislation would create the Mental Health Crisis Response Working Group, aimed at getting law enforcement, EMS, emergency departments, and healthcare providers on the same page.
The next step in the evolution of crisis response, which is adding, as mentioned earlier, a peer response crisis worker as the third leg of the stool of law enforcement, social worker, clinician, and peer support crisis worker.
In Montpelier, Devin Bates, Local 44 News.